Okay. Hi, I'm David from LifeRx Wellness, and most people have problems with their lower back from sitting in their cars a long time. Sometimes it's from work, sitting on the computer, a lot of sitting. Even if you play golf or tennis, pickleball, you're going to be using a lot of the same muscles over and over and over again. And some people do stretches, but they're these little passive nothing stretches that really don't do anything. And sometimes people don't really have time to exercise or strengthen. But if you do have pain and you have problems with your lower back, I'm going to demonstrate to you what I would do for that. It's going to be a quicker video than a longer session. But now, this is Jay, and you have problems with your lower back. Is that true?
I have a stiffness. I've been working on it because all my life, I'm a therapist too. I've been leaned from one leg to another, and that's create that disbalance in my hips and in my spine. And yes, I have that stiffness on my right side.
Okay, so I'm going to turn you around this way towards the camera a little bit more. Okay, so would you say it's around in this area?
Yeah.
Okay, does it go all the way across sometimes, or is it mostly on the right?
It's most on the right.
Does it go into your hip area here and maybe down in the leg, this part here?
Yeah, before there was sciatica, which is, but
okay,
not
I'm
anymore.
I'm going to turn you back around. Okay, so you said what again, sciatica?
It was a long time ago, but I do exercise in the morning, and it's not there, but I feel stiffness.
So a lot of the reasons for that are because the muscles are not moving well. They're stuck there. So there's many contributions to the lower back, and I'm going to show you in a quicker way, show you a hands-on demonstration as to what I would do for that. I have been doing treatments for lower backs for over 20 years, and I can tell you that it really works. It's really amazing. The soft tissue is what's considered muscles. Soft tissue is muscles, tendons, ligaments, bursa. I don't work on the ligaments as much, but
He's talked too much. Let's do it, man. I can't wait. I can't wait. I want to lay down.
He wants to lay down.
Exactly.
All right.
This is what I want.
So
Why you just
take off your shirt.
Thank you. Yes.
And
I need that.
you're going to be
Feel comfortable. Goddamn.
You
Let's
feel
do
comfortable?
massage.
He's comfortable.
Let's do it. Let's do it. I can't wait.
Okay, so the first thing I'm going to look at some of his quads. So if the quads are tight, it's going to cause trouble for your low back. Now, when you're lying down, does your low back bother you? Is this position okay, being on your back?
No, actually, it's release that.
Release,
tension.
okay. All right, so I am going to look at the quads a little bit here and just see what I feel in there. So his quads are tight. Now, I am going to, here, I am going to warm up. I'm going to show you what I'm going to do. Here.
Get this camera and put it right in here,
Okay,
so you can see it.
okay.
So, can you see me?
Look. Yeah, let me take a look here. Yes, I can see you. Yeah, it looks good here.
Okay, perfect.
Okay. All right, for low back treatment, there's a few things that you got to do, that I'm going to do. His muscles of his lower back are now falling away from his nerves. So I'm going to put his arm here, and I'm going to go underneath. Now, this is the right side, but you are pointing more to the left. Your left side of your low back was the tightest, right?
The right one.
The right one. Okay.
And when you touch it, I feel there's a lot of tension up there.
Okay. So what I want you to know is that I'm not going to do this too long because you can't see it, but I'm going to work on his paraspinals, on all the low back muscles and his middle back muscles, and I'm going to warm them up so that there's more blood flow, that as I progressively get deeper, it's not going to hurt him, because people's low backs are very sensitive and they're very tight, and I need a way to get in there and loosen it fast. So warming it up while he's face up, the low back muscles fall away from the nerves. So I want you to feel what this feels like in here.
It's sore.
It's sore because I can tell that the muscles of his paraspinal muscles, which include the fascia and other soft tissue, are going to be a big factor for him. So I'm going to warm it up a little bit. So you can cut this off, you can cut it. So I'm going to just do a little bit of work on it, and then you could just cut it, edit it, So here, but I need to do something in here.
Yeah, just tell them what you do. I can explain them.
Okay, I'm working on his paraspinals and getting them to move better from underneath. It's hard to explain, but
no. So what I'm feeling, what was the David doing right now? He's close to my laminum groove and what he's doing, because my body, his weight is pushing down against the table, and he just raised his finger up, pull his finger up, and my body is pushing against his finger. So I am doing the work, and all he's just moving that that deep friction, perpendicular to that muscle fiber. And
so this is where you're getting stuck. So I can find where his low back muscles are hitting his pelvis that's jamming him up. Okay, now he can exercise all he wants, but it's going to help him to get movement in these little fibers.
And where he's touched it is very sore. It's not pain,
yes.
But it's sore.
It's very sore, but people can handle it. People can handle this because it's away from the nerves.
And if clients experience pain, trust me, he's not going to be relaxed. He's going to be guarding. So don't push this too much. And always look at the client face. If you start making the faces like this, that's mean this uncomfortable.
Exactly.
So
I do that all the time. I look at the client's face all the time to see if they're grimacing, and because they sometimes don't want to tell me that it hurts.
Yeah. In Russia, it's called grimasa.
Grimasa.
Grimasa. Cabronas. Okay. Yeah, that feels great. I can feel it start releasing.
So I can.
He's a hard worker. I'm definitely. Yeah, it's hard work.
This is hard work. I'm a worker, but I use my hands correctly so it doesn't cause me any trouble. But it is hard work. There's no question. Jay's work is good too because I don't have to work as hard, but I include all his work too. I just stole it all.
Let's talk about your work. So
I want to talk about how I stole.
He stole it. Yes. Because I give it away. Take it, stole it, use it. And David do the same. He's teaching you guys how to help your clients. And if you in Los Angeles, if your client with stiff lower back, definitely that's what you're going to love. Because I'm already, like I said, I'm that witness. It's feel great. And he find that spot, which is he's touching
right here.
And I feel it, yes. And this is exactly what it is because it's a L4, L5, and I always have that problem with this area. I mean, I keep working on myself. I'm aware of this problem, but it's feel great, yes.
So this is what he could not do himself. He could do all the weight training, rehab, but there are certain areas that are very, very difficult to access.
What you can do, you can grab that spine, put it on the side, and just show him what exactly your movements on that spine.
Oh, you mean on the spine over here?
On the spine right there, yeah. So grab the spine and
show
okay,
here.
How do you move? Just imagine I'm laid down, so the spine is here, but you put it up here, and you just show it to them. Let me hold you for you.
Okay.
So show it to
all right, so here, look. So this is the spine here. This treatment is magical because it doesn't hurt and I can find where exactly your problem is. So here's the spine. And now the muscles are here along each side of the spine. You have your paraspinals. So this is the right side. So I'm underneath. I go underneath like this, and I'm pulling like this underneath. This is my fingers are going in here like that, all over the entire spine. And the muscles, because he's lying like this, are falling down away from these nerves and all of the nerves. So it feels, no matter how I've had people who had the worst pain, who could barely get on the table, but if they could I can get them like this, I can decompress and figure out all the problems very quickly. So I'm going to look at his left side a little bit because I don't want him to be out of balance. So I'm going to do a little bit on the left side, on the right side.
Oh, it's so
right. So I can figure out what is not moving. So these need to move better. All this needs to move.
You mean the muscle or vertebra is not moving?
No, the soft tissue.
Soft tissue.
The soft tissue, the
Fascia,
paraspinal, the paraspinals, the erector spinae group are not moving well enough. He's doing exercises, but I'm going to move it for him like now, so it's going to be so much easier.
That's what the most people want. Just move for them. I'm not going to do anything about it.
But they will, but I want them to do the rehab exercises because I can get room, I can make room, but I can't make it any stronger.
Exactly.
So here. So this is where you're having troubles.
This is like a blessing, guys. This is like right there, yes.
This is something you would never be able to have access yourself. Someone has to do this for you. But if I put you face down first and did not do it this way, it wouldn't be warmed up. It would be very painful. I would be pushing these tight muscles into your nerves, and that would really hurt. So I'm doing it in a different way that is really going to help you.
And this is great. So you can, guys, try all different variation.
Now this is you have to know how to work from underneath. So there is a training to work. How do you work underneath the body? But I've trained many people on it. I even trained a blind girl to do it.
You like say like there's something wrong with it. I think it's blind people get that more sensitive fingers and they feel more than non-blind people.
It's
Because
true.
if one sense is shut it down, the other senses get more sharper.
It's true. So here, I'm just giving it a little bit of warm up in here. But this is where I would warm him up. I could tell that this is a problem, big problem for him. So,
I mean,
okay.
I can feel it sore, yes.
Yes, okay. So then I do that part. Then I'm gonna do some quad. So I can find out what part of the quad is the tightest. So I'm just leaning my body weight and I can find out what part of his quad is causing him a restriction. So I'm not trying to stretch the quads. Okay, I'm not stretching the quads because the quads, they don't need stretching like that. It's a very different thing. But I'm looking for something that's jammed where it's stuck and it's preventing the unit from moving. That's very different than trying to, you don't take elbows and jam it into quads because it's just not going to help this person. So I can tell not all part of his quad is an issue, but there's a little part in here, this little part right in this section here that isn't moving as well as everything else. So I'm going to do that. This is part of the low back treatment, and I'm going to warm it up a little bit and see if I can find what's tight. Now,
And David he's doing fast because it's a video, the duration of the video, but you slow down. You don't rush yourself through those movements. You do this quicker, just show you the whole sequence of his movements. I mean, his the session.
So I can find out where it is. So I'm going to show him where it might restrict. See, most everything is very good. You don't have very too much, but there's one little spot, this one right here. This isn't moving well. It feels like, see, because look how good you are in all these areas, okay? This is all good. This part is good. So I have a system of being able to pull. I pull my fingers and I can find, so what part is his problem of his quads? So I'm pulling here, and I only feel like he has some restriction right in here. It's like, I think it's his vastus intermedialis, or maybe it's the rectus femoris.
Yeah, and I feel it too.
So I'm not stretching it, but what I'm going to do is I'm warming it up, and I'm just getting movement in the little fibers that are stuck, and that's all I'm going to do. Because this whole idea of stretching these quads causes people more trouble. And you don't want to be causing more trouble. So, do you feel where some of this stuff feels kind of stuck?
Yeah, I feel it.
Yeah, okay. So I'm going to go in here. I'm just going to take a look very fast at this one so he is not lopsided.
Yeah, this is really sore one.
This is your sore, the left one sore?
Yeah, it's sore.
Why is your left quad sore?
I don't know, it's just sore.
Oh, from your workout?
But it's no pain.
Oh, I see. When I work on it, it feels sore.
It's just sore. I mean, it's sore in general because I'm leaning on that leg all the time.
Oh, I see. Okay. Because he leans on the leg. Now, a lot of people lean on their one leg at a time. But if you get soft tissue therapy like this, or manual therapy, physiotherapy, you can prevent back problems, knee injuries, ankle injuries, because it's all linked. So you wind up, cars need repair often. And people don't do anything to repair their bodies. And it causes them a lot of trouble.
No, they don't.
Well, so now, this includes the IT band. The IT band is definitely not to be stretched like the quad, because the IT band has to stabilize your body. You don't want it flopping around being overly stretched. So you want to find where it's stuck. So I could see why it might get sore in here, because he has a tight, the rectus femoris. So there are 4 muscles in this section. The quad is called quad because it has 4 muscles. And one of his muscles all the way to the top, it doesn't move very well. So the reason I think he gets troubles, it's if you're standing more on one leg, it's going to be multiple imbalances. So I'm right now only looking at his quad, but I'd look at his hip, and I look at his low back, and there's of course his hip flexors, and there's a lot of things to look at. So I'm just taking it quickly here. So this feels like here, yeah. So it's going all the way up. So in this leg, you can tell this isn't moving good.
But my sorenesses go away and it's feel great. Mm-hmm. It's not like sore anymore.
Now, so this is really, look how in here, this is not moving so good. There's a little part in here. Okay. All right, so that is now I'm going to put you on your left side.
Okay.
So I'm going to put him on his left side so you can see what's going on with his back. So I'm going to give him this pillow for under his head. Like that. And I'm also going to give him a little pillow for between his knees so it doesn't bother him. Okay. So I want you to see. So now I've warmed it up.
I'll make sure that the camera is coming. I mean, you can see it on the phone.
Yeah, I think I can. Hold
A
on.
little bit like, yeah.
Yeah, I.
Don't rush. Don't worry. I'll adjust everything.
Oh, I see. To put it so you could see because of the angle I'm at. Okay. There. All right. Here. I think I got it here. All right. All right.
Yeah, whatever you can
Okay.
see. There we go.
So I'm going to be able to. Now I'm using kind of a lot of oil because people have a lot of pain in here. So I start with more oil and then I put less and less on. I could take off the oil with the sheet. But you see, people are very nervous because you're working on something that has so much pain. So I'm able to soothe it out. So I'm going to warm it up and so that they can trust my hands. It feels very soothing. So I'm just take some time and I warm up his back. And I can even do his left side too. So I do the left and the right. And I can look at his neck also in here. Now this might have more oil than you use, isn't that correct?
That's fine. Yeah.
Okay, so I warm it up. So now they're feeling more relaxed. I'm getting more movement in here. And now because I'm pulling my fingers, which you can't really see, I'm going to go into the areas and find out. I'm going down to lengthen everything. And so I'm going to go along the paraspinals. And I'm looking for where it's stuck. What muscles are hard in there that should be loose, that should have some movement in there. Right here. You could find it pretty quick on him because he's stronger.
Just wait a little bit. Okay, here we go.
Okay, so now I'm going in and I'm finding out. So this is a low back treatment, so I'm going to do some of the hip. But you have to warm up the muscles for a little while, and then the problem, it surfaces, so it makes it really easy for you to find. If you don't warm it up, it kind of hides. But as you get more blood flow and the person's relaxed and it kind of feels like a massage, I'm sliding all over the place and it feels very soothing. So I can find what is stuck. So here. So as I go into here, I can find right here, this right in here, here. I could find all the tight spots over here. So you can tell right here, this is where I was before. So you warm it up. This is all the soft tissue here, and now I can move it. Now on him, he's very strong. He works out a lot. Weights, bands, all sorts of stuff. You can tell his muscles are strong. So sometimes you've got to, you can work on it sometimes and find it and soothe it out really easily. But because he's so strong, you have to pin it down. You have to pin up. The whole muscle moves as a unit on him. These are like hockey players. These are baseball players. I've worked on a lot of professional sports people. So you have to find a way to get it to move. Now, so I can find it all in here. Here, okay. This is all soft tissue. This is something you could not do on your own. So I'm lengthening each of the little fibers one by one. So here, so this is a unit. So I've got to make these move individually. They shouldn't move in a clump. Your back shouldn't be in a clump. It has to be broken up. So now that's not painful, is it?
No, it's not. It feels great.
It feels good. He says it feels great. Because I've warmed it up and I'm going at a good pressure that's right for him. Here. So I'm getting movement in all sorts of spots. So let's just see how he is. And I even feel, I didn't do his psoas, which I might have to do, but I can do some of it in here. So sometimes you can find it in here. Now, does that feel tight or anything?
Yeah.
Or are you not much?
No, it's feel okay.
Okay. All right. So I'm going to start at the top, and I'm going to go down and see where does he get stuck. Where is it? Here, here, here. Well, it's mostly there. A lot of things from in here. Do you feel like a lot of things are in this very low back?
But I feel good. I feel more relaxed now.
Yeah.
I don't know why people waiting so long in this stiff back. And you can tell they like get up from the car, they walk and it's stiff, but you can truly get that stiffness away, get that more mobility in your spine, in your back.
So I know the anatomy, and I know that he should have space in here. When I push in this section, it should be soft. It should be pliable. It shouldn't be like this hard floor that I'm standing on. So people don't know. In fact, most people don't know what it's like to have a normal, relaxed back. They wait till they're in pain. So here, I can find there. Because this doesn't feel bad. That doesn't feel bad. That doesn't feel bad. Okay. So now I'm going to look at his hips. So I'm going to go over here. Now I get on top of the table, so I have a little bit more. I could lower the table down, but for the sake of the video, I'm just going to do it. So I'm not stretching his IT band. I'm just moving it a little bit to see if anything is stuck. That's the difference. Sometimes people are rolling too hard on those foam rollers, and they're trying to loosen their IT band because it hurts. But most of the time, it is not the IT band itself, it's your hip. Your hip is out of balance, and you just have certain problems that are causing your trouble. You go online and the AI will even tell you to work on your IT band. But most of the time it's coming from your hip in here. There's an imbalance in your low back, your hips, and your hips can be off, like one's higher than the other. So now I'm looking for where is he having trouble in his hip. Because if he's standing on one leg, he's standing on the left leg, but so I can find it. So I'm finding areas and moving the areas that are stuck. So I'm looking on this right side. Now, does it feel like I'm hitting some tight spots?
No, I feel good. Yeah, some gluteus medius is always sensitive, so but
yeah,
it's feel great.
Now the gluteus, this is a sensitive spot, but I work it from when he's lying face up, and then when he's on his side, I warm it up first with my flat hands, and then you can go in and work on it. Now, I didn't do his hip flexors while he was on his back. I was too excited about getting him on his side, but I'm looking for problems. So there's like a little sections, a little like right in here. This could be more. Right in here. Glute medius. So every time you walk, right in here, and the glute maximus, sometimes the piriformis is tight too, but so I'm looking what could be tight on him. Let's see here. So here. So I'm moving these fibers in here. This is the long way. I mean, this is not, it's not using stretching methods and other methods. This is just more of the hands-on method. So here. Does this hip bother you too, or not much? It's mostly your left, right?
Yeah, it's not anymore. It's feel great. It was sore in the morning. Yeah.
Mm-hmm. Yeah. So I can feel. So this, I'm looking for this, like this fiber here. So if this doesn't move, this section doesn't move, it's going to cause him a lot of trouble. So I have to warm it up and get movement on all these little fibers. So I'm looking for this. But this is really, loosening this part is going to help his lower back. If this is tight, it can absolutely make this very tight. Now, I do the same thing to the other side. Now, on him, his quadratus lumborum, it's not terrible or anything. So I'm going to put you on your stomach.
Okay.
Okay. Okay, I'll move this pillow
Now
here.
get the camera so it's like pointing this way. Put it right here.
Oh, okay. All right. I'm going to give you a pillow for under your ankles. And okay. So
yeah, make sure like this camera.
Yeah.
Take this one, put it up here,
okay.
and it's look at my back. You see my back? You see your.
Yeah.
Is that recording? You see the red light or no?
Yeah, it's recording.
Okay, now take this one too, put it up here so it's gonna be
Okay.
see. See if you can see it.
Okay. This one here, like that?
Yeah, you can see me?
Yeah.
You sure?
Uh-huh.
Okay then. And you can lower table.
Yeah, that's true. Okay, yeah. Lower the table. Okay, so now I'm going to take a look at his hamstrings because the hamstrings are important here. They bring your leg back and they bend your knee. So your hamstrings bring your leg back and they flex your knee. So they do two things, and you have to make sure that the fibers that are doing that are all good. Because if your hamstrings, now, I'm not stretching his hamstrings like the quads. I'm not stretching them because they're just out of balance, and I have to figure out what is stuck and preventing, like if he does the physical rehab, what's going to prevent him from getting better in the soft tissue? So I'm looking for some problems. I'm not lengthening and stretching his hamstrings. So I'm looking over here and I'm feeling for where it can get tight. So this is his left side, and So it feels a little bit restrictive right there. Does that feel restrictive to you?
Yeah, it feels sore a little bit and kind of, yeah, sensitive, but it's no pain.
Okay, it's no pain, but he feels sensitive. So by opening up the fibers that are stuck, he's going to be able to do his rehabilitation exercises better, and it's going to be able to help his low back. So I'm warming it up, and I'm squeezing into it, and I'm looking for some of the problems in here so I can figure it out. What doesn't move well? So right here, this little fiber here. So I'm just going to move it for him. There are no stretches that you can do for this. You cannot stretch this out. You're not going to be able, because it's not a stretching problem. People think to help their low back, they need to stretch everything. And that isn't really true. Okay, so here, looking in there. I can work his left hip a little bit since I worked on the right one. So here I can find some of the problems there, but right here, so this is one clump. He's lost the individual power from all of his hamstrings and all the fibers, because when you get injured, they all clump as one. So this may look like I'm stretching it, but really what I'm doing is I'm just separating the fibers so that they can do their thing for him normally, and he'll feel it right away when he gets up and everything. So here. Okay, so this is one clump. I'm going to show you the whole unit. This is your whole clump. It goes like this. Clump, clump, there. So now I'm going in to move it here. Okay. So this fiber right here, here. So now I'm going to move it for you right here. So if this moves better, you're going to feel better. This is the tightest spot right here. And then I'm going to look at his other hamstring for just a minute. Then I'm going to do his back. Just a couple little things on his back. But what's happening is that, so for the lower back, you want to loosen all the muscles of the middle back, lower back, and some of the upper back. You're going to do the hips, hamstrings. You're going to check the quads, make sure those are just not stuck. IT band, and then his hip flexors, which I haven't done. And at the very end, I might need to sit him up if he has a trouble still, because there are things you can do to fine-tune. Fine-tune the back, work on the back while they're sitting. And that sometimes will help it. So I'm still warming it up, but I could find this is a tighter hamstring, not tighter. Tighter is not the right word. I mean, he's got a few extra fibers that are just stuck. And there's a difference between a muscle being stuck and trying to stretch it. So I'm now I'm warming it up because I can feel where it's tight in there. Here. So now I'm moving it for him. So he's probably had very few people that are actually going to be able to unstick his hamstring. I am one of them. So what you're feeling now is you being unstuck. That's what that feels like. Is it painful? Okay. You can tell that it's just a clump. So you unclump the fibers that are causing him his trouble. It could have been from an injury. It could be scar tissue from surgery or an accident. But this side is definitely a tighter hamstring than his left. And he was having problems with his right side. So here, this is what it feels like for me to move it. Now see, he doesn't even know what it's like to have all the fibers of his hamstring firing correctly. But I can do it because I've warmed it up and I'm using a method that is not painful. It's not going to make him tense up. It doesn't make you tense up when I do this, does it? No. Notice he's a big guy compared to me. I'm like 5', 6.5". You're 6 foot.
6'2".
6'2". He's 6'2", and he's a strong, muscular guy. But I don't need to be super, super strong. If I use my body weight correctly and I use my hands correctly, you can work on somebody like this and still do very well. So it goes all the way down. His hamstring, you can tell, it's much different than the other one. Much different. So these are the muscles that need movement right here. See, all in here. So I'm just going to finish up here. I'm going to do the back really quick. So I'm finishing up with his hamstring here, which is very tight. Okay, and now I'm going to do some work on his back. Okay, now he's doing good. So straighten it out here. Down. Now I can tell on him you definitely don't want to use your elbows. Not on him, because it's not going to feel good. You're going to be just squishing all of his nerves. Some people are good to use an elbow with. Some people are not right for using your elbow. But so for here. So here. I'm looking for trouble. I'm looking for what's not moving very good, but I know it's his right side of his low back. So let's see, where is it bothering him? Here. There. Maybe it's here. Yeah, it's like in here. This is the area. This is it's two. It's just in the same position all the time. These fibers do not fire very well. I could tell that from when he was lying on his back and when he was on his side. These muscles they don't move very well. So if I move them for him, his body will do it all on its own. Yeah. So I can feel just where the muscles are not moving good. So I don't know where some of his back muscles are perfectly fine and some are just way too hard and tight. They're restricted. They don't move. They don't move well. They're stuck. So I'm now looking here and I do feel where it is over here. So you just have to warm it up and go in a little. Now this feels like an area that bothers you, doesn't it?
No, not anymore. I feel good.
It feels good?
Hmm.
Okay, so it doesn't bother him. But I can tell this is where he's stuck. Right here. So, what does it feel like when I work in here? Sore?
It's not anymore. It was in the beginning.
Okay. So he doesn't feel any pain or anything, but I can tell that this is where he has probably scar tissue from old injury. This feels like old injury here. Yeah, like that. That's okay. This is okay.
Right there.
So this is what this doesn't move. A lot of everything else does move, but this little thing in here is what's giving him trouble. Here, let's see. Here. All of this. This is something that he cannot do himself. There's no way that he can stretch this. There's no way he can do anything about this. So he has to get treatment on something like this to move it. Because I have to warm it up and find those little fibers. This is why these massage robots are never going to be good, because they're never going to be able to do this. They cannot figure it out, even with AI. Let's see here. So this is where you got jammed up here. And then that was his left side. I'm going to take a look at the left side now. I did the right side, and now I'm just going to look a little bit on his left, even though it wasn't so bad, but here. Now I'm going to measure his hips. I'm going to see. They're even. He's even here. He's even here. And he's even. He's even. His hips are even now. So that's good. I'm just doing a little bit more on the left. just to balance it out. Even I have to do both sides, so I'll feel better there. Okay. All right, now you're all finished. So I'll let you get up, and you could, if you want, you could put on your shirt.
Hold on.
You-
Ask me now.
Yeah. All right, now how are you doing?
I feel great. I feel so relaxed. This is what I need. This is all we need. I don't know why people like so waiting for so long. This is what you guys needed. That stiffness is stuck in your body. You release this through those hands, and this is the way to maintain this. I feel great.
Mm-hmm.
Thank you, David.
Yes, so there he goes. His hips are straight. I checked them, and so he's going to be doing good.
I'm ready to sleep. I gotta get out of here now.
All right, bye.
Bye. Thank you, guys. I hope you enjoyed it.